Good evening, everyone, and I wanted to welcome you to our sports performance talk. We're going to be talking about the things that the experts don't tell you about enhancing your performance naturally. So we realize there could be lots of questions for you this evening, and Dr. Justine has made herself available at 647-987-9355 to answer all of your questions. So I wanted to welcome Dr. Justine with us this evening. So she is an incredible athlete and has a vast amount of experience in the world of hockey, but also just in other areas. And, you know, she's that girl, she's that advocate that really has promoted and really focused her life and her dedication to. So she's a chiropractor, she's a mom, she's an author, she's a public speaker, and she is an incredible leader to our Justine Blaney Wellness Center, to our naturopathic care team that is here for you. Please help me welcome Dr. Justine.
Hello, everybody. So awesome topic today because I have had enough injuries being, 5'4" playing hockey with guys that are 6 foot and taller and bigger. So we're going to go through how chiropractic, how therapies can help you with sport performance. But we always have amazing topics coming up. So coming up in April, we'll have information about juicing with Dr. Udani, information about diabetes and diet and how to prevent diabetes and manage diabetes, foods to manage your blood sugars, and of course, different information about getting that stretching you need, the yoga that you need to reduce your stress and to help those muscles be better balanced. So today's focus, we're going to be talking about 5 things that you can learn today. We're going to talk about the truth of enhancing your performance, whether it's for, the Olympians, the weekend athlete, it doesn't matter. We all just want to be our best. We're going to talk about 5 nutrients to improve your performance, types of foods to avoid. I know nobody wants to hear that, but just add more of that good stuff. Lifestyle habits to get that compound effect, to get the better changes, and different types of injuries and how to recover from them. Having been through many injuries, I'll give you some stories. And of course, the key ingredient that helps athletes be their best, all the top Olympians, all the top performers. So when we think about it, why would you want to do this? Because we want to perform at our best. We want to be the best athlete, the best mom, the best dad, the best sister or brother. We just want to have a ton of energy and be able to perform at our best without drugs, without enhancing performance products if we can. But the challenge is there's just so much confusion on what do you need, what types of therapies, what types of injuries, can you resolve those injuries, what kind of team approach, what kind of products. So our goal today is to try and answer some of those questions. When we're looking at the 3 components of performance, we want to make sure we manage chemical stresses, chemicals that you can add, or nutrients that you can add to get the best performance, the best mindset for healing potential, especially after different injuries or to just increase performance. And then, of course, physically, the muscles, nerves, and joints. And with that 3-pronged approach, that's how the stool stands up. That's how you get the best results. So when we talk about one of those is taking care of the nervous system, because the nervous system controls that fight or flight, when your body can really perform at its fastest, when you're in the middle of the game and you need to be fast, you need to be strong, you need to be powerful, but also that opportunity when you need to relax those muscles, you need to give that body a break, that nervous system a break. So the nervous system controls all function, and it controls your strength, your power, your reflexes as well. And that's why top athletes know that they need to take care of their nervous system as well as the practicing their actual skill and relaxing those muscles, ligaments, and tissues. So how does this body heal? Like, it's not the cast that does the healing. It's not the Band-Aid that does the healing. When you put that Band-Aid, it's the amazing potential on the inside of the body that's actually doing that healing. So where's that healing come from? It comes from the notochord. So just when you're a baby, the very first thing in your body is that notochord. And it will, from there, you will see from that notochord, then you will see the heart grow, then you will see the lungs grow, then you will see the limbs grow, the muscles come out of it. But right at the very beginning, it is that notochord that controls all function. And that is the area that we want to make sure is able to function at its best in order for us to perform at a top level. So that nervous system has that fight or flight response. Now, most of us just want to relax, just to sleep but if we're in that relaxed state, that's not top performance. We need the relaxed state in that time of Sabbath to have a break in order to get top performance, because that's the area what's going to get help with recovery. That's the area that's going to help with digestion. That's the area that's going to help with sleep, help with hormones. But the fight or flight, yes, it increases your blood pressure, it increases stress hormones, it can increase inflammation, but it also is the one that in that state where you're going to sometimes get that top performance level. Just like the Olympic athlete, where it's right at the beginning of their race, their heart's going to be pumping, their body's going to be excited in order to perform at that highest level. So when we talk about the 5 keys to increase your function, one of the big components of those is improving your nervous system function. We need to make sure that nervous system controls everything, whether the messages to your muscles, your arms, your legs. It also is the nervous system that controls your eyes. So it's going to control what you see, your balance, what you hear, how you digest your food. As we go into these 5 levels, one of the big ones is visualization. So with hockey, I used to, sit in the arena and just, feel the cold air, smell the sweaty smell. You used to hear the puck against the boards, and I would visualize, that breakaway, putting it top shelf, or I would visualize, that perfect pass as a defenseman coming around the net, hitting my winger as they made that perfect breakout. I would focus on our deep breathing so that when you have proper breathing, you'll be able to perform at a top level, and you'll be able to and not have the jitters, so that you are able to execute almost whatever the sport, whatever the activity, unconsciously. So I know even when my daughter was in figure skating, they would take the group of synchronized figure skaters and they would talk about, okay, let's visualize this pattern in this part of the ice, visualize, this circle in that part of the ice, know who you're holding hands with. In whether it's in soccer or football, you would visualize the play and everybody executing their job. So this visualization can be done alone, or it can be done one-on-one. I apologize for the phone, but we'll leave that go. This book is excellent. This is called A Life Without Limits, and it's by Chrissy Wellington. With Chrissy Wellington, she was a top athlete, did many triathlons, ultra marathons, and she did something called visualization. She called it couch exercises. So she said the couch time was equally as important as her training time, her time that she would be running or cycling or swimming. She would spend the time on her couch going through that run, making sure the transitions of getting off the bike, changing her clothes, getting out of a wetsuit. She knew mentally where she was putting her clothes, what foot was going into the bike first, what foot was going into which shoe first. She would visualize if the bike broke down, how would she quickly repair the bike? If she fell, how would she quickly get back up onto that bike? So that visualization is a key component for performance. It is also a key component for injury healing. So when I first injured my knee, the first time I've injured my knee several times, I went to a sports psychologist, and she would talk to us about the healing and visualizing the knee getting stronger, being able to perform better with your weightlifting, having better balance, being able to visualize yourself being strong as you took a hit into the boards or you fell and you were able to get back up after strengthening and empowering and going through the healing process. Because after any injury, you kind of have this psyche of, oh my God, it might get hurt again. You don't want to go through this again. And you have to break that down and put yourself into some visualizing into stressful situations like a fall, like a trauma, like another hit in the boards. And how do you recover from that without an injury? So, visualization is absolutely key for sport performance and for healing. I'll give you an example of somebody who broke their spine. They actually broke one of their vertebrae, and the patient spent the time bedridden, but visualizing the bones coming back together. So spent time studying anatomy, studying and looking at the bones, visualizing that bone coming back together so they could get back to their sport of snowboarding. And sure enough, he was back on the slopes with that spinal fracture having healed fully. So next step that we go into is avoiding of those 5 steps, avoiding inflammatory foods. And that's sugars, things that make a sugar, your packaged foods, your refined carbs, things that come in a bag or come in a can and come in a plastic typically aren't your best. Those white things like white pasta, white rice, white potatoes, white salt, um, things like crackers and donuts or pop, soda, they just, anti-nutrient foods are not going to help our top athletes. Getting rid of those fake sugars. Go with the real sugars, the things like real fruit, real maple syrup, pure unpasteurized honey. Stay away from the things like Splenda, Sweet and Low, high fructose corn syrup, your diet pops, your diet yogurts, things that are diet typically have those fake sugars that make you crave more sugar, and can create inflammation and affect your healing. We want to get rid of those fake oils or those trans oils. So get rid of things like canola oil, vegetable oil, soy oil, corn oil, those microwave foods, potato chips, fried foods. These are foods that are going to prolong your recovery. And we typically want to go things as fresh as possible. So they're not in a can, they're not in a bag. The things that come from, Mother Nature, come from are things that you can get fresh, are going to help you get the best results. Looking at things like the Dirty Dozen, the Clean 15 that you can look up to help you get the good foods in order to respond better. Some of the nutrients that you can add to boost your performance: berries, any kind of berries, blackberries. My favorite are raspberries, blueberries, raspberries, helping with the good fats like coconut oil, avocados, avocado a day, healthy nuts and seeds, almonds, cashews, walnuts. Looking at beets because they have that nitric oxide, they help your mitochondria function better. Looking at clean protein, so that's wild fish, grass-fed foods, grass-fed beef, free-range chicken and eggs, adding bone broth, foods that help your gut, like sauerkraut, kimchi, your healthy omega-3s, so your fish oils or adding a fish supplement, looking at things like vitamin D3 supplement, increasing your water intake, especially as you're exercising more to help your discs rehydrate, help your joints function better. Your healthy fats help your joints, help your ligaments, help your brain function. And then you can look at things like as you're healing from different injuries or high levels of performance, looking at things like curcumin or turmeric. But I highly recommend, if you're looking at different supplements like glucosamine, that you have a health professional like a naturopath helping guide you so you're not overwhelming your system. If you're adding different things, supplements like sports drinks, just looking at things that don't have those fake sugars and you're not adding too much supplements. For example, I remember with the Olympics, some of my teammates were adding different supplements that actually increased their risk of injury and made their muscles look stronger but more prone to tear. So definitely when you're adding supplements, be very, very careful. Do your research and add a holistic nutritionist, add a naturopath in order to get the right results for yourself. I do believe having that team approach. So if you're an athlete, you need to take care of your muscles like a massage. So I typically get my massage therapy done once a month, a proper nutritionist on your team, chiropractor to help with your alignment. And of course, I'll talk a little bit more about physiotherapy and how that can help on your health journey. Number 4 is proper sleep. Now, this is different for everybody. Certainly, I probably don't get enough, but somewhere in that area to 7 to 9 hours. Everybody's a little bit different. I do think that napping can be great if you're able. That little power rest of somewhere, 12 minutes to 20 minutes can really help with recovery periods. Making sure that our recovery foods and liquids and water is super important. But with sleep, very important getting a circadian rhythm, a same time period. This is very difficult for athletes who have like late games or early runs and then have to fit many different activities along with working periods. Many athletes, even at the highest level, have to fit their athletics around a working period, or kids with school periods. So looking at going to bed similar times and getting up similar times. I know my high level runners, in the summer when it's really hot, they might be running at midnight when it's cooler. So then they're going to have to really sort of shift that sleep time, sleep schedule, and that is definitely more difficult. The hours before midnight count twice as much. So ideally, you want to get a couple of hours sleep before midnight if you can, in order to get the best response. And then you just can't catch up sleep. So you can't say, oh, I'll get 4 hours tonight, and then on the weekend, I'll take an extra nap. It is still better to have a similar rhythm of sleep. Changing it by a half an hour or so is fine. But ideally, you want to have similar time periods, similar area of sleep where the environment is cooler, less electronics around you, less distractions, no TV. So that environment is conducive for sleep. All right. I love this message. Before I was shown it, I always kind of had to check where the gas tank is for especially when you get a rental car. So when you look this where you see your gas tank, you will see the little arrow on the side of the little gas tank symbol, and that will tell you which side of the car to go to the gas station on to fill your tank. And so we have these little messages that maybe we're not aware of. And that's why we need a team approach, because many of the health professionals will be able to point out something that you don't know, or in some cases, but you've forgotten. So an example is even the top professionals, chiropractors, sports, athletic therapists, still need to go to other professionals when they've been injured to guide them in their healing and guide them for top performance. The fifth thing is taking care of your spine and your alignment. Your brain requires awesome feedback from your muscles to your brain, and from your brain to your muscles, or from your brain to help with reflexes, or to help with digestion, or to help with balance. And so what a chiropractor does is find and remove any interference in those messages. So an example was Superman. We thought of as super strong, super powerful. He fell off his horse and injured, you can see, in just that small area in his neck. And then, of course, we remember that he became a quadriplegic. And just that small area caused him, you can see from this, hunk of a guy to aging super, super fast, almost 25 years of aging super quickly by that small injury to his top part of his neck. You can see it's just the size of a pinky that damaged his neck. And then when you have damage in your neck, it affects his balance, his coordination, his digestion. You can see you need a breathing tube. It affects his arm and his legs. So super, super important for athletes to take care of their neck in order to have top performance. And some of the physical, stresses in that top part of your neck can be sitting too much. Sitting, especially with these laptops, sitting leaning forward. Right now, I'm standing in order to do this. So have those standing desks can be super, super important, so that we have at least getting up, as my daughter calls it, an activity snack, but getting up regularly throughout every hour, getting up and getting moving at a minute, 2 minutes would be great, so that we're not bent over. They call sitting the new smoking. It damages your joints and your discs and reduces your performance. Even if you run an hour a day, it's still all the sitting time can't be undone by going for a half an hour or an hour walk or even an hour run. We know that the more forward time on our cell phones, the more forward head posture of our neck makes our head heavier. If our head is 60 degrees forward, it almost makes your head 60 pounds. If our head is 45 degrees forward, it almost makes your head 45 pounds. So we need to aim towards having our ear over our shoulders. So if we are on our phone, instead of head down, we want to have that phone in front of us like this. And if your arms are tired, then your head and your neck is tired. Again, remembering that this top part of your neck affects your cerebellum, affects your balance, affects your blood pressure, affects your coordination. And the other area of physical stress on the neck is even the birth trauma. Even whether you talk about normal delivery, that's challenging. You got to yank on the head. And then if you add things like suction or forceps, puts more damage on that top part of your neck. So if we look at the spine, it affects every function, every physiological function of your body, including breathing. And breathing is super important for top level of athletic performance in order just to manage the stress of being able to perform. So what chiropractors are is experts at finding and removing subluxations. That's areas that put pressure, interfere on that brain-body function, brain-body communication, and our goal is to remove that stressor on your body. So if your spine is out of line, your nervous system releases stress hormones, inflammatory hormones affecting your body. And that's kind of like putting a bear in the room and you go, ah, right? And then if you're under stress or scared or not, you're not able to be able to function at that top level. So if you think about that bear in the room, if you had a bear, are you going to focus on your digestion? No way. Are you going to focus on good quality sleep? No way. Are you going to focus on top performance of athletics? No. When you're stressed, you focus on the stress. You think about, and you're going to be worried, and you're not going to be able to get the proper strength. Typically, if we're stressed, we feel more fatigued, more poor memory. We're not going to remember, steps of our performance. We're not going to remember what our coach told us to do. So one of the best ways is to find ways to reduce that stress. Because even if you have top level nutrition, but you have poor stress, you're not going to be able to function your best. Even if you do all the stretches, all the exercise, all the practices, but if you're super stressed, you still can't perform. So even with awesome nutrition, exercises, stretching, practicing with your coach, great sleep, if you have stress in your nervous system, you're not going to get top level performance. So for us, we want to do as chiropractors is try to remove that stress on your system to increase your overall potential to be able to digest those foods properly, to get a better night's sleep, to improve that function of those muscles. Now, there's tons of research on this. When you work at the vagus nerve, the nerve at the top of the spine, they know that that's like the CEO of calming your body down. They know when they did PET scans of after adjustments, they know that it can calm down that sympathetic nervous system. They know if they did research on those athletes getting adjusted, they could actually jump higher. They found that it can improve balance, it can improve memory, it can improve strength. We know that there are numerous symptoms that if you are subluxated, that can be affecting your overall performance. So if you have these areas of subluxation can affect, of course, pain and inflammation, but it also can make you more irritable. It can affect your digestion, can affect your sleep. It can affect your anxiety, your stress, and affecting performance. But many times, if you have areas of subluxation, you might not feel any pain at all, but you're still having lowered performance. And that's why we recommend that everybody has at least a checkup. And what a checkup involves is a proper history. It involves palpation, which is gently touching the spine or the areas of injury. During nerve scans, SEMG muscle scans, x-rays if required, checking your range of motion and your posture. So a chiropractor and a physiotherapist, a naturopath, a athletic therapist, they would be going through different tests like this in order to determine those areas that are not functioning at their best, regardless if you have pain or not, in order to help improve performance. We do want to look at your posture. There's no way if the head is forward or the shoulders are forward, are you going to be able to breathe as well? You're going to have the increased strength and be able to have the best balance. We know that as our shoulders are back, our head is over shoulders, that balance and that improved posture will improve sports function, improve physiology, improve how your nervous system is sending messages to the rest of your body. So there's tons of research on helping with stress, and we know that stress is one of the leading causes of disease, so it's super important to find ways to reduce stress. Now, I want to go into a few different lifestyle hints. Number one is having that right attitude, maximizing your mind, that winning attitude. And I know if we've been injured, it's so easy to get down. I know I get frustrated, like, how long is this injury going to last? Sometimes, I've healed from separated shoulders in just 4 weeks, or a sprained ankle, and 4 weeks and you're back in the game. I remember when I injured my knee badly, I needed a big black Dawn Joy brace, and it took almost 3 years of wearing that big black brace before I got strong enough to go to a smaller brace and then get rid of that brace. I know when I injured my back, it took 3 months before I could really train at the highest levels, super levels of frustration over those 3 months, and still need to do the right exercise and core in order to be able to train at the highest level. I know when I recently injured my neck, first from a hockey hit sideways, how it affected numbness and tingling my hands, that it's been almost a year of trying to work with therapies in order to deal with degenerative disc and damage. So definitely that winning attitude that you can beat this is super important. I think of my colleague, Dr. Colin Alkin. He actually was doing motocross biking, fell off his bike and broke his neck, and his bone shattered. And he had to wear a halo and a brace on his neck, even when he was working. Only that at a year later, full 100% recovery and back able to do all of his sports activities. Number two is having sleep days or recovery days. Just like I said with Chrissy, this top athlete, great book to follow, is that recovery or couch time, changing your workouts in order to change. So you're not working the same muscles every day. You're not changing the sequence of your workouts, sequence of your training is super important. And that requires having a plan, making sure you have a plan for your weightlifting, planning for your running, plan for your getting ready for competitions, creating the goal setting and the visualization to get there. to have the visualization, to have the training plan, to have the right recovery times, to stay mentally set, I do believe you need a healthcare team along with a great coach. And on your healthcare team, you can have your chiropractor, your massage therapist, your athletic therapist, your sports psychologist, your physiotherapist, your medical doctor, your nutritionist. We need to put all of that together and have everybody working for you. Now, doesn't matter, even if it's the best team, the best plan, you can still get wear and tear with these different joints, and that's or trauma that happens with these different sports injuries. So, what we want to know is that these injuries can have affect all different parts of your body. I've injured my neck, my shoulders, my elbows, my fingers, your back. You can your hip flexors, your knees, your ankles, and chiropractors and physiotherapists can work on all these areas in order to be able to help you recover faster. Some of the common sports injuries is your knee. For me, injure my knee, you can fall typically on the inside of your knee, very common. Or if you get something blocking you or you're hitting like a football tackle, can injure your what's called your unhappy triad, your meniscus, which is the shock absorber in your joints, or the ligaments, the four main ligaments in your knee. So you want to have the ligaments tested. Typically, that can't be done right away because of the inflammation. But you see the get a proper assessment, X-rays, and then often an MRI to check for that meniscus tear. The goal is to check the ligaments, check the meniscus, and then follow up with proper rehab. And that can be done with a physiotherapist and a chiropractor. They might do things like current, they might do ultrasound, they might do taping, and of course, they would give you specific exercises to start strengthening your knee and check what's called the kinetic chain, your hip, your knee, your ankle, to make sure that there's proper alignment and all the joints are working together. So with knee injuries, you can often see you can have often affected with your feet. So if you have flat feet, that can cause your knees to bow in and then make it more stressful on the inside of your knees, affecting your MCL, your medial collateral ligament, your medial meniscus. Sometimes the kneecap cannot be moving properly, so we want to check that that kneecap is in the proper alignment for things like patellofemoral. This terrible triad or unhappy triad is what happened to me, which means that it can affect your ACL, your anterior ligament, your medial ligament, and your meniscus. And that's why I ended up with the big DonJoy brace, which can really affect your performance, but you can recover from this right with that team approach. You see a picture of the meniscus there. So you have different parts of the meniscus that can be torn. So some people will get a scope done to kind of clean up that debris in their meniscus. Some people will get a needle injection to add sort of into that joint space, give them some extra time, especially if they have arthritis before a knee replacement. Some of the shoulder dislocations, I remember I had watched somebody just slam their shoulders into the wall in order to put their shoulder back in and get back on the ice. Kind of dangerous, but you see it often because once you've had a shoulder dislocation, it can happen more often. Personally, I had separated my shoulders 3 times on the right and twice on the left, just showing that it can happen over and over again and how super important it is to have proper rehabilitation, a great team approach. With my shoulders, I used a lot of acupuncture and chiropractor helping the ribs and the spinal alignment from my neck into my shoulders and the mid back. The acupuncture helping the rotator cuff to heal better. Had to wear a sling to hold it up so the joints don't separate and get them closer together. So there's different rotator cuff damages. Often it's the supraspinatus. The rotator cuff is made of 4 muscles that sort of wrap around the shoulder there. And it's important to have all 4 evaluated and worked on. They are often injured with repetitive strain like throwing or swimming or overhead tennis or overhead work. and repetitive strain. So massage therapists work with the rotator cuff, physiotherapists, as well as chiropractors. And you want to check which of the specific rotator cuff muscles are affected. Are there areas of inflammation like tendonitis? Or is there any areas of bursitis, the fluid sac being affected? And that would mean if the fluid sac is affected, the bursa, you would need more rest. Compared to if there's tendonitis, you need to reduce inflammation. Versus if there's muscle tension, you want to relax it more with massage therapy. So you want to have the right diagnosis. And ultrasound with your medical doctor can help you, along with an MRI, to determine if you have a tear or tendonitis or bursitis. Now, disc injuries in your lower back, we have all heard of Tiger Woods and the damage that he did to his back. And if it's not taken care of, it can lead to surgeries. Unfortunately, many of those surgeries go badly. So it's so much more important to try and avoid surgery. So you'll see that the disc in that top picture on your under the word herniation on your right, on my right, you will see that the disc can leak out into that spinal cord and put pressure on that spinal cord, affecting the nerves that can go down your legs. And you often can determine if you have a disc herniation because if you sneeze, cough, it can increase pain and it can shoot down your legs. It can be affected with a lot of sitting, can affect disc damage, and especially a lot of rotary sports. You can get damage down your leg. You can also get affected with going to the bathroom more frequently, or loss of control. If you do have numbness and tingling in the saddle region between the legs, loss of function of going to the bathroom, that is when you want to go to the hospital and get an MRI right away to determine how much damage that disc might affect in your spinal cord, or the cauda equina, the nerves at the tailbone area, to make sure how much damage there is. It is most common at the L4, L5 area, that's the lower back, because of that shearing compression force. And so the best thing you can do is work on proper alignment, proper core strengthening to help with prevention, especially if you have rotary sports like golf, like tennis, like baseball, or rotary activities for work. You definitely want to work on prevention, taking care of your disc in order to try and prevent any type of surgery as much as possible. If you look at the ribs, many times when people have rib injuries, they have pain behind their scapula, behind their shoulder blade, and it can be affected, of course, by an impact like a fall or trauma or pushed into the boards, but it also can be affected by this sneeze or cough that people do into their armpit, affects those ribs. Sleeping with your arm above your head, sleeping on your stomach with your arm above your head, or curvature of the spine can affect those ribs and cause them to be out or subluxated. I've had patients think they're having a heart attack because it wraps around to their chest. So, of course, make sure you check your breathing, you check your heart rate. If those are areas of concern, go to the hospital to check your heart. But if you find that that part is normal, a chiropractor is able to adjust those ribs, work on those ribs to help with that scapular or rib pain that can wrap around into the chest. Neck injuries can affect from your neck. Sometimes people call it a stinger or a torticollis. They feel stuck. They wake up like this. And that affects the brachial plexus, the nerves from your neck that go into your shoulders and then go down your arms. So super important, because if there's neck injuries, that can lead to things like headaches, migraines, depression, neurological symptoms down your arms, numbness, tingling, weakness, hot and cold into your hands. So getting your neck checked by a chiropractor is super important. Having x-rays done, proper spinal images, proper neurological tests to determine how to respond back from that neck injury. Necks can be injured from many, many different sports and car accidents to follow up. Concussions are so much better taken care of. I love this soccer picture. My very first concussion was playing soccer, where my head came in contact with the ball and a foot. The other person went off to the ambulance because they were unconscious, and myself, so the person that had their foot fell back on their head and was unconscious. But me, I didn't become unconscious, so I was able. They just asked me my name, and I blurted out my name and continued to play. But they came home and passed out. So determined that I had concussion and went to the hospital. Um, Concussions today, much better therapies, availabilities to work with your physiotherapist. We have Satu, who does a lot of work for balance and concussion work. Chiropractors work with that whiplash that affects with your neck, and then affects into your head. Works with Turner technique. Some people will do cranial sacral therapy to work with the bones in your head, but certainly never take a concussion um, uh, with ease. You want to make sure you take it seriously, have the right care, the right rest, so that you have less risk of a second concussion quickly. Ankle injuries. This often happens with soccer or sports on a field or on a court. Most common is the outside part of the ankle, affecting the ligaments and how the navicular will function in the ankle. So many physiotherapists will do laser, will do ultrasound, they'll do taping. Chiropractors will try and adjust the different bones. There's, over 26 different bones, over 100 ligaments in your ankle. And you need your feet to function, your ankles to function properly in order to help your knees and your hips. Ankle injuries, if it's a low grade, can respond in just a couple of weeks. A serious one can take, 4 to 6 weeks in order to get better recovery. Very, very important with tears and ligaments is to get the right care so that the problem, you don't have as much risk of re-injuring that area. And certainly what I didn't know as a young athlete, and that's part of the reason why injuring my shoulders and my knees multiple times. So getting the right care at the beginning, but also the right strengthening. And that's why I work on my shoulders all the time with a personal trainer so that I don't re-injure those joints again. All right. Taking that time for recovery. And one of the toughest things is taking a break from top level performance. As athletes, we just want to get back into it as quickly as possible. So super important to have your professional let you know when to rest and when to push, when you can tape and keep performing, like you see in the Olympians with, a taped shoulder, a taped knee, and when to take that rest time. So definitely getting that right team approach. One of the things I didn't talk about was cupping. You saw that with our top level swimmers, they'd see these like round bruises on their muscles, but cupping can help release the muscle tension and help those muscles function well. And they use that often with rotator cuff injuries, but even back injuries and leg injuries. I had it done when I tore my calf muscles. So super helpful. And our massage therapists, acupuncture, and physiotherapists all do cupping procedures. It is definitely shown with multiple levels of research. When you don't take the right rest, you can increase your risk of super severe injuries. So you see some of these top athletes get back in the game and then they can tear their Achilles and then ruin their next season. So making sure you have that right management. The goal is as much as you can natural management. It doesn't mean that at times you won't need an anti-inflammatory, a painkiller when those injuries are severe at the beginning. But goal is long-term to be able to function with your sports without medication and with proper function on your own. So when you're looking at different medications, discuss the risks and benefits with your medical doctor and making sure you know that if there's any risks of addiction, how you can improve overall function and take away the risks of side effects of those medications. And that can be discussed with your medical doctor, your naturopath, in order to slowly get off those different medications and painkillers and work towards increasing your strength, your balance, your power, so that you'll be able to perform your sports naturally. Chiropractors are there. We help with inflammation. We help with relaxation of the body, helping your body function better for better blood flow, better joint mobility, better range of motion, better nerve flow. But I do believe that a chiropractor should work with your physiotherapist, your athletic therapist, acupuncturist in order for proper performance and injury recovery. And if you look at the best of the best, whether you think of some of my favorites, Arnold Schwarzenegger, Brady, you'll know that the best athletes in the world will have a chiropractor on their sports and healthcare team. And there's just tons of research, whether you go from Michael Jordan to Arnold Schwarzenegger, Tom Brady, many of them have quoted that having a chiropractor on their team and their healthcare team will help them improve their overall performance, not just injury healing, but allow them to function with better speed, better agility, better reflexes in order to achieve the highest level of their game in their sport. So I'm so happy you joined us today. Add a chiropractor, add an athletic therapist, add a physiotherapist to your healthcare team. Join us for our upcoming talks on juicing. Top athletes will add juicing to increase their nutrients, as well as different types of protein shakes. We have our upcoming talk on diabetes, on ways to reduce blood sugars. And of course, I do think that yoga or high levels of stretching can improve sports performance. So we have our talk coming up on yoga and yoga breathing. Join us with all of our talks. We're happy to include us. They are free, so share them with friends. Give us a review, because we'd love to help as many people as possible. Thank you for joining us, and we look forward to seeing you again soon.
Thank you, Dr. Justine.